Hey everyone, it's Ada, and welcome back to the channel. Today we're diving into a topic that's incredibly close to my heart, and something every single cat owner needs to be aware of: feline health. Our cats are more than just pets, they're family. They bring so much joy, comfort, and, hilarious antics into our lives. But part of being a responsible and loving cat parent is understanding their health needs and being able to spot when something isn't right. Cats are notorious for hiding illness, a survival instinct left over from their wild ancestors. This means that by the time we notice obvious symptoms, a problem might already be quite advanced. That's why being proactive and educated is really our best tool. In this video, we're going to break down the top 10 most common health issues that can affect our feline friends. We'll cover everything from respiratory infections and serious viruses to chronic conditions that often appear in older cats. My goal isn't to scare you, but to empower you with knowledge. Knowing what to look for, understanding the potential risks, and recognizing the early warning signs can make all the difference in the world. It can lead to quicker diagnoses, more effective treatments, and ultimately a longer, happier, and healthier life for your beloved companion. So grab a notebook, settle in with your furry friend, and let's get started. We're going to go through these one by one, discussing symptoms, causes, and what you can do. This information is a fundamental part of providing the best possible care for your cat. Think of this as your essential guide to feline wellness. By the end of this video, you'll be a more informed and confident cat owner, ready to advocate for your pet's health. Let's jump right in. First up on our list is something many of you might have already encountered, especially if you have more than one cat-feline upper respiratory infections, or URIs. Think of it as the feline equivalent of the common cold in humans. It's incredibly contagious and can spread like wildfire in environments where cats are in close proximity, like shelters, catteries, or even just your own multi-cat household. The primary culprits are usually viruses, with feline herpes virus and feline calicivirus being the most common offenders, but bacteria can also cause or complicate these infections. It's really all about direct contact with an infected cat or their secretions. So, what should you be looking for? The symptoms are very similar to what we experience with a cold. You'll likely notice sneezing, a runny nose with clear or colored discharge, and watery eyes that might be red and inflamed, a condition known as conjunctivitis. Some cats might also develop sores in their mouth or on their tongue, especially with calicivirus. They might lose their appetite because they can't smell their food, become lethargic, and even run a fever. If you see these signs, especially if one cat starts showing them and you have others, it's crucial to isolate the sick kitty and get in touch with your vet for a proper diagnosis and treatment plan. Next, we're talking about a very serious and highly contagious viral disease, feline panleukopenia, often called feline distemper. This one is not to be taken lightly. It's caused by a type of parvovirus that is incredibly resilient and can survive in the environment for a year or even longer. This virus attacks and destroys rapidly dividing cells in a cat's body, primarily those in the bone marrow, intestinal tract, and in the developing brains of kittens. This leads to a dangerously low white blood cell count, the panleukopenia part of the name, which cripples the immune system and leaves the cat vulnerable to other infections. The symptoms of panleukopenia can come on suddenly and be severe. They include profound depression, loss of appetite, high fever, vomiting, and severe diarrhea, which can sometimes be bloody. Dehydration happens very quickly and is a major concern. For kittens, the mortality rate is tragically high. But here's the most important takeaway for this disease: it is highly preventable. The core vaccination that your kitten receives, often called the FVRCP vaccine, protects against panleukopenia. This is why sticking to your vet's recommended vaccination schedule is not just a suggestion, it's a life-saving measure for your cat. Moving on to number 3, we have the feline leukemia virus, or FeLV. This is one of the most common infectious diseases in cats, and it's a retrovirus that can cause both cancerous and non-cancerous conditions. It's often called the friendly cat disease because it's primarily spread through prolonged, close contact between cats. The virus is present in saliva, nasal secretions, urine, feces, and milk. So, things like mutual grooming, sharing food and water bowls, and sharing litter boxes are common modes of transmission. Bite wounds can also spread it, but it's less common than with another virus we'll discuss soon. Once a cat is infected with FeLV, the virus can lead to a wide range of health problems. The biggest issue is that it severely suppresses the immune system, making the cat susceptible to a whole host of secondary infections that a healthy cat could easily fight off. It can also cause anemia, lymphoma, and, as the name suggests, leukemia. Sadly, there is no cure for FeLV. However, that doesn't mean it's an immediate death sentence. With dedicated supportive care, a good diet, a stress-free indoor environment, and prompt treatment for secondary infections, many FeLV-positive cats can live happy lives for several years. Vaccination is available and highly recommended, especially for cats that go outdoors. Our fourth topic is another retrovirus that you've likely heard of, feline immunodeficiency virus, or FIV. This virus is often compared to HIV in humans, and while they are in the same family of viruses, it's crucial to know that FIV is a feline-only disease and cannot be transmitted to people. Unlike FeLV, which is spread through friendly contact, FIV is primarily transmitted through deep bite wounds that occur during aggressive fights. This is why it's most commonly seen in unneutered male cats with outdoor access who are territorial and prone to fighting. Casual, non-aggressive contact is very unlikely to spread the virus. Similar to HIV, FIV works by attacking and weakening the cat's immune system. An infected cat may not show any symptoms for years after the initial infection. However, as the virus progresses, their immune system becomes less and less effective. This makes them highly vulnerable to secondary infections of the skin, mouth, and respiratory tract. Chronic dental disease, or gingivostomatitis, is very common in FIV-positive cats. There is no cure for FIV, but with excellent care, keeping them strictly indoors to protect them from infections and to prevent them from spreading the virus, many FIV-positive cats can live a normal lifespan. All right, let's talk about something that can make your skin crawl: parasites. These unwanted guests come in two main categories: external and internal. External parasites live on your cat's skin and fur. The most common culprits are fleas, which can cause intense itching, allergic reactions, and even transmit tapeworms. Then you have ticks, which can attach to your cat and transmit serious diseases like Lyme disease, although this is more common in dogs. Ear mites are another nasty pest, causing a dark, crumbly discharge and intense irritation inside the ears. Then we have the internal parasites, which live inside your cat's body, usually in the intestinal tract. These include roundworms and hookworms, which are very common, especially in kittens who can get them from their mother's milk. Tapeworms, as I mentioned, are often contracted by ingesting fleas during grooming. And then there are single-celled protozoan parasites like Giardia and Coccidia, which can cause significant diarrhea. Symptoms of internal parasites can range from a dull coat and a potbelly appearance to vomiting, diarrhea, and weight loss. The key here is prevention and regular deworming as recommended by your vet. This next one is incredibly common, yet so often overlooked by owners: dental disease. It's estimated that the majority of cats over the age of 3 have some form of dental issue. It typically starts with plaque, a sticky film of bacteria building up on the teeth. If not removed, this plaque hardens into tartar or calculus. This leads to gingivitis, which is inflammation of the gums. You might notice redness or swelling along the gum line. If left untreated, it progresses to periodontitis, a more severe condition where the structures supporting the teeth are destroyed, leading to pain, infection, and eventual tooth loss. The signs of dental disease can be subtle at first. The most common sign is bad breath, and I don't just mean regular cat food breath, but a truly foul odor. You might also notice your cat dropping food while eating, chewing on only one side of their mouth, drooling, or pawing at their face. They might become reluctant to eat hard food or avoid eating altogether. Regular at-home care like brushing, along with professional dental cleanings under anesthesia at your vet's office, are essential for preventing pain and serious health complications, as dental bacteria can travel through the bloodstream and affect organs like the heart and kidneys. Now we're moving into a condition that is a major concern for our senior feline companions: chronic kidney disease, or CKD. The kidneys are amazing organs that filter waste from the blood, regulate blood pressure, and produce important hormones. In CKD, the kidney function gradually deteriorates over a period of months or years. It's an incredibly common diagnosis in older cats, and unfortunately, the damage is progressive and irreversible. The exact cause isn't always known, but it can be linked to genetics, infections, toxins, and other diseases. Because the onset is so gradual, the early signs are often missed. One of the very first things owners might notice is an increase in thirst and urination. Your cat might be visiting the water bowl more often, or you might find yourself cleaning larger clumps from the litter box. As the disease progresses, you may see weight loss, a poor coat, decreased appetite, lethargy, and vomiting. While there's no cure for CKD, there are many ways to manage it to improve your cat's quality of life and slow the progression. This includes special prescription diets, medications to manage blood pressure, and fluid therapy to help with hydration. Number 8 on our list is another common ailment of middle-aged and senior cats, hyperthyroidism. This is an endocrine disorder where the thyroid gland, located in the neck, becomes overactive and produces an excess of thyroid hormone. Think of the thyroid as the body's thermostat or engine. It controls the metabolic rate. When it's in overdrive, it speeds everything up. In most cases, this is caused by a benign tumor called an adenoma on the thyroid gland. It's very rarely a malignant cancer. The classic signs of hyperthyroidism can seem, honestly, a bit contradictory. You'll often have a cat with a ravenous appetite, eating everything in sight, yet they are losing weight. This is because their supercharged metabolism is burning through calories at an incredible rate. They might also be hyperactive or restless, yowling more than usual, especially at night, and appear agitated. Other signs include increased thirst and urination, occasional vomiting or diarrhea, and a poor or unkempt coat. The good news is that hyperthyroidism is very treatable. Options include daily medication, a special prescription diet, radioactive iodine therapy, which is often curative, or surgery. Let's discuss a condition that can be particularly frightening because it's often hidden heart disease. The most common type of heart disease in cats by a long shot is hypertrophic cardiomyopathy, or HCM. In this condition, the muscular walls of the heart's main pumping chamber, the left ventricle, thicken abnormally. This thickening makes the heart muscle stiff, so it can't relax properly to fill with blood, and it has to work much harder to pump blood out to the rest of the body. Certain breeds like the Maine Coon and Ragdoll have a genetic predisposition to HCM. The truly scary thing about HCM is that many cats show no symptoms at all in the early stages. The disease can go undetected for years. When signs do appear, they can include lethargy, decreased appetite, or an increased respiratory rate even when resting. The first sign for many cats, tragically, is sudden and acute congestive heart failure, which involves difficulty breathing, open mouth breathing or panting, or a sudden paralysis of the hind legs due to a blood clot. Diagnosis is typically made by a veterinarian listening for a heart murmur or gallop rhythm, followed by a chest X-ray or, more definitively, an echocardiogram, which is an ultrasound of the heart. Last but certainly not least, we have two of the most common symptoms that will send any cat owner running to the vet: vomiting and diarrhea. These aren't diseases in themselves, but rather symptoms of an underlying problem. The list of potential causes is incredibly long and ranges from the very simple to the very serious. It could be something as minor as a dietary indiscretion. Your cat ate something they shouldn't have, a sudden change in food, or a hairball that's trying to come up. These acute, one-off instances often resolve on their own. However, when vomiting or diarrhea becomes chronic, lasting for more than a day or two, or if it's accompanied by other signs like lethargy, appetite loss, or blood, it's a red flag that something more is going on. The cause could be one of the things we've already discussed, like internal parasites, kidney disease, or hyperthyroidism. But it could also be due to food allergies, inflammatory bowel disease, pancreatitis, or even cancer. Because the causes are so varied, it's absolutely essential to not just guess. A thorough diagnostic workup by your veterinarian is needed to pinpoint the cause and get your cat on the right treatment plan. And that's a wrap on the top 10 most common health issues in cats. I know that was a ton of information and some of it can sound pretty scary. But remember, the whole point of this is to arm you with knowledge, not fear. Being an observant and informed owner is the single best thing you can be for your cat. You are their first line of defense. By knowing these potential signs and symptoms, you're better equipped to catch problems early, communicate effectively with your veterinarian, and make sure your furry family member gets the care they need as quickly as possible. Your vigilance truly can save their life. This journey of pet ownership is all about learning and growing together. We've covered a lot of the what, but I know you might be wondering about the how. How do we prevent some of these things? What does a proper vaccination schedule look like for a kitten versus an adult cat? What are the best preventative parasite treatments? These are all fantastic and important questions. If that's something you'd be interested in, a deeper dive into prevention strategies and wellness plans, please let me know down in the comments. Your feedback really helps me decide what content to create for you next. Thank you so much for joining me today and for taking this time to learn more about your cat's health. It shows how much you truly care. If you found this video helpful, please give it a thumbs up. And don't forget to subscribe and hit that notification bell so you don't miss future videos. Sharing this video could also help another cat owner out there. Until next time, give your cats an extra scratch behind the ears from me and stay curious.